For the most part, we found that the toxicities were in line with what one would expect for Ibrutinib's safety profile. With treatment exposures, I think for the most part patients tolerated the drug quite well. So with our follow-up of 19 months, the median number of cycles delivered were 16.5. And in fact, a quarter of patients have already completed 2 or more years of Ibrutinib maintenance. With these patients, 2 of them have actually even completed the full 4 years with our data at this point. In terms of the toxicities, about 2/3 of patients actually had drug-related adverse events that required dose modification. 19% of those patients actually required a permanent dose modification or reduction, and 25% of our patients, which equates to 9 patients, actually needed permanent discontinuation of drug. And the main reason for discontinuation seemed to be atrial fibrillation or flutter, and that was actually in 5 out of the 9 patients that required dose discontinuation. But for the most part, the agent was actually quite well tolerated, and again, the toxicities were manageable and in line with what one would expect for Ibrutinib.